There is no doubt that you will coach clients on physical components of wellness, but we will focus somewhat on those that are more tied to cardiovascular health in this section. Right now, we're not doing very well in this area, and most of us could use some coaching in terms of changing behaviors that put us at risk for cardiovascular disease. We don't expect a master level of human anatomy to pass this course successfully, but you will feel more comfortable in knowing basic muscular anatomy and systems within the body. In order for you to be effective as a coach, you may need to provide physical activity guidelines to your client in the form of an exercise program design. Since a large part of your coaching will consist of managing risk factors in the client, you'll need to understand some of the basic conditions by description in order to have intelligent conversations with your client. This is not meant to replace more detailed learning in areas where you feel you need to increase your knowledge level. Preventing heart disease is always a preferred strategy as opposed to simply treating it upon the onset of it within your client's health profile. Although prevention includes regular exercise, good nutritional practices, refraining from excessive alcohol and tobacco intake, and maintaining ideal biometrics, you will also need to be aware of risk factors that are present in your client. Cardiovascular disease is a term that includes a group of diseases that affect the heart and the blood vessels and circulatory system. The most prevalent is coronary heart disease and is sometimes also referred to as coronary artery disease. Although coronary heart disease is just one type of heart disease, it's responsible for about half of all heart disease deaths in people under the age of 75. Up until recently, the death rate for heart disease in the United States was on the decline. However, we're seeing a troubling trend in terms of these numbers stabilizing and again beginning to increase within certain segments of our population here in the United States. Circulation is also important to understand and will require that you become familiar with the basic anatomy and functions of the human heart. Now, the human heart consists of cardiac muscle and weighs about 8 to 10 ounces. Arteries function to carry oxygenated blood away from the heart, while veins carry deoxygenated blood back to the heart, where it is then pumped into the pulmonary circuit to pick up oxygen for use once again in bodily tissues. The primary function of circulation is to provide a constant supply of blood and nutrients to cells and tissues, while at the same time removing waste products. These are just a few functions of blood. The circulatory system in itself requires a little bit more closer look for us to be able to understand it completely. Blood serves different purposes in the human body as it nourishes all the tissues that it comes in contact with while transporting hormones, vitamins, and antibodies throughout the body. Blood also helps to regulate heat and temperature within the body and of course is the source for oxygen for tissues within the body. As you can see from the slide, there are 4 chambers of the heart, and to understand the flow of blood through the heart, we start with the left atrium and trace it through the circuit until it's returned back to the heart from the pulmonary system by way of the pulmonary vein. Be sure that you can work through all of the different structures that are listed on the slide as you trace the flow of blood through the heart. This also has implications related to blood pressure. Wellness coaches should all be skilled in obtaining blood pressure values or readings from their clients. Furthermore, it's important to know that the normal values for blood pressure are 120/80. The first number represents the systolic measure of blood as it exerts pressure against artery walls. The second number, the diastolic blood pressure value, is the relaxation phase of the pressure applied to the walls of the arteries and is viewed to be the second part or the relaxation phase of the heart's contraction-relaxation cycle. Blood, along with the circulatory system, works to carry oxygen away from the heart. Blood plasma is clear and contains approximately 100 chemicals. Plasma makes up about 55% of blood content, and the remaining 45% consists of blood solids, such as erythrocytes, leukocytes, and platelets. Blood uses the circulatory system for transport, and this consists of veins and arteries. In order for blood to dump oxygen to tissues in the body and then to return back to be reoxygenated, it relies on circulation throughout the body and an efficient pump to facilitate flow. Coronary heart disease affects the ability of blood to flow freely to the heart muscle. This can result in heart attacks or other heart-related problems. Blood also is a carrier for cholesterol, which tends to get hung up within the lining or walls of arteries and can become problematic in terms of increasing blood pressure and putting one at risk for the formation of arterial plaque. Strokes are defined as cerebrovascular accidents or brain attacks. Now, because strokes tend to follow the same sequence of events that result in coronary heart disease, we typically see strokes occurring at a high correlation rate among those who have heart disease. Essentially, a stroke is the result of blood vessels that are diseased to a point of not being able to supply the brain with oxygenated blood. Sometimes strokes can be caused by what's called a thrombus, which is a type of clot that blocks arteries. In many ways, strokes are viewed as circulatory problems in this way, but can also be rooted in arterial plaque dislodging and blocking the flow of oxygenated blood to the brain. Therefore, the medical community has learned to manage prevention by monitoring ideal blood pressure values and cholesterol levels for patients who present with metrics that pose risks for cerebral vascular accidents. Sometimes we overlook the most basic way to help us prevent stroke, which is through increasing physical activity. Be mindful of this when you think about strokes. In terms of risk factors, we have to understand that there are two different types, both uncontrollable and controllable. The controllable risk factors are family history of heart disease, age, and environmental risks that we have no control over. The controllable factors include high blood pressure, smoking, hypercholesterolemia, excessive body weight, physical inactivity, stress, and type 2 diabetes. In general, guidelines for total cholesterol also determine our client's category of risk. Now refer to your manual in Part 5A for these categories. You've most likely heard of both good and bad cholesterol. Good cholesterol is considered the high-density lipoprotein or HDL value. The main goal in controlling cholesterol is to both lower LDL or low-density lipoproteins while raising HDL cholesterol. Typically, doctors determine goals for lowering both overall and LDL cholesterol based on the number of risk factors that the client is seen to have for heart disease. Cholesterol is treated with a class of drugs called statins, which target both LDL and HDL values. Cholesterol is consumed in foods but also is generated by the liver. Therefore, there's no way to tell based on appearance if someone's cholesterol values are within range or not. The good news is that physical activity, once again, is a natural way to control cholesterol, but there's a limit to how much it can help for someone with extremely high values. And these are people who are genetically predisposed to hypercholesterolemia. As we've mentioned before, having blood pressure within normal range is important in the control of heart disease. Wellness coaches measure blood pressure frequently, and this is a fundamental skill required of each coach. Being able to explain blood pressure to your client is also a useful way for your client to understand its significance. Assessing blood pressure is a very common practice, and you'll find yourself doing it many times throughout the day. Blood pressure is considered too low when it causes symptoms of fainting, dizziness, or lightheadedness, and this is known as hypotension. Elevated blood pressure can result from a variety of causes. Elevated levels of stress hormones that act as vasoconstrictors can elevate blood pressure. Elevated levels of sodium in the diet can increase blood pressure by retaining water in the system. Arterial plaque on the inside lining of arteries can also increase blood pressure. With age, the elasticity of our arteries decreases and can lead to high blood pressure as well. There's also a genetic component to high blood pressure too. Hypertension is a medical term for high blood pressure, and blood pressure is considered to be high when it is at 140/90. Again, 120/80 is normal blood pressure, and occasionally you will see blood pressure values at or below 90/55, which is then a hypotensive reading. Blood pressure should always be taken on the left arm after your client has sat for about 2 minutes. If your first reading is elevated, you may want to wait a few minutes before attempting a second reading. For most of us, it's pretty clear that smoking is a risky behavior. There's enough research to draw conclusions that using tobacco in both smoke and smokeless forms has negative consequences on our health overall. When working with a client who smokes, you may have to rely somewhat on the intellectual aspect of coaching to persuade behavior change. Smoking also increases LDL cholesterol while decreasing good or HDL cholesterol values due to the effects of nicotine on the system. Nicotine is an extremely addictive drug regardless of how it's ingested. The effects to the user are the same regardless. If your client smokes, cessation efforts may be at the top of your priority list. It is true that most people do know the dangers of smoking, but they may not be aware of the benefits of quitting cigarettes or tobacco. Some of these benefits include blood pressure and heart rates decreasing as the body stabilizes. After the first 24 hours of quitting, the risk for sudden heart attack decreases and the risk for coronary artery disease declines by 50% after 1 year of quitting overall. Circulation is seen to improve while lung cancer risk decreases by 50% after 5 years of quitting smoking. The likelihood of death from lung cancer in smokers is similar to a non-smoker after 10 years of a cessation effort. Coronary artery disease risks improve to that of a non-smoker after a 5-year time period of quitting. When we use or say the term physical activity, we are referring to any sort of physical movements that result in an energy expenditure. Physical activity would include walking, strength training, running, and even activities that we would typically rank as active rest like mowing the lawn or raking leaves. Clients who exercise regularly above a moderate level are seen to benefit from this practice as longevity is increased by 1 minute for every 1 minute spent walking and bicycling and 2 minutes for every minute spent jogging, according to the American Journal of Epidemiology. Furthermore, research shows that there's a relationship between the amount of activity and cardiovascular disease risks. Being overweight is defined as carrying excess body weight for one's height regardless of body composition. On the other hand, obesity is then defined as carrying an excess of body fat regardless of height. Obesity strains the heart and tends to be seen with other modifiable risk factors that can lead to cardiovascular disease. We recommend the use of the ACSM standards of body composition as a reference point with your clients. If you have known anybody with diabetes, you know the challenges they've faced with normal everyday functions. Type 1 diabetes is a condition where no insulin is produced by the pancreas and insulin injections are required. The onset for type 1 diabetes is usually earlier in life. Type 2 diabetes is the non-insulin dependent type of diabetes and usually occurs in middle-aged, overweight, sedentary adults. Type 2 diabetes is more easily controlled and under the influence of prescription medications as well as physical activity. Clients who may be diabetic pose challenges to wellness coaches when they are not compliant with the demands of managing their condition or the disease. The medical community uses the A1C test as a measure to assess blood glucose levels in diabetics. This test is used to help newly diagnosed diabetics determine how elevated their uncontrolled blood glucose levels have been over a period of time. It's also used as a method of monitoring diabetic patients. Now, moving away from those risk factors tied to wellness coaching and cardiovascular disease in your client, we transition into other physical components of wellness. Let's begin by talking about muscular strength. Now, this is the maximum force that a muscle or muscle group can exert in a single contraction and is best developed through high-intensity training and lifting heavier loads at a lower rep count. Defining muscular strength for the client becomes important when you consider that muscular development enhances health improvement while improving fitness levels and providing clients with both aesthetic and cosmetic benefits to those who seek change in these areas. Muscular strength is most directly impacted by resistance training, but should be complemented with aerobic forms of exercise too. As we've mentioned, muscular strength is most directly impacted through resistance training. Now, your client may not be the type to enjoy resistance training, and so it then becomes necessary to point out some of the benefits to this type or mode of exercise. Some of the benefits to resistance training are listed in your manual in Part 5A. These include increasing muscle mass and therefore increasing basal metabolic rate while helping to promote improvements in bone density, and exercise even has protective factors for both emotional and mental wellness and health. If your background is not in exercise science, it's still important to be aware of basic human anatomy in terms of muscles and their origins, insertions, and actions. We've also included this information in your manual, again in Part 5A. In Part 5B, we'll resume exploration of even more components of physical wellness.